A lot of what's marketed as narcissist treatment doesn't have evidence to back it up. Some approaches are genuinely useful, some are experimental, some are a waste of time and money. On this episode, we'll map out what the different therapies look like for narcissistic personality disorder. Vaknin argues there is no known therapy that cures narcissism. Not CBT, not psychodynamic therapy, not even his own cold therapy, which we'll get into. What several modalities do is modify behavior, reduce the most destructive patterns, improve relational functioning, make the person less dangerous to be around and less tortured from the inside. That is a real and meaningful outcome, but it's not a cure. Vaknin, though, excludes psychodynamic therapies, humanistic therapies, transactional analysis, EMDR, and body centered therapies because there's insufficient peer-reviewed data demonstrating efficacy with cluster B personality disorders. It's not because they're useless, but because the evidence bar has not been met. For the purposes of this therapy map, we are sticking to the approaches with published outcome data. The third wave of behavioral therapy provides a conceptual backdrop for everything that follows. First wave behavior therapy used conditioning and reinforcement to change observable behavior. Second wave cognitive therapy added focus on negative automatic thoughts and cognitive distortions. Third wave therapy combines cognitive techniques with a commitment to the therapeutic relationship as the primary agent of change. The relationship itself becomes the laboratory for learning a different way of being in connection with another person. DBT, Dialectical Behavior Therapy, was developed by Marshall Linehan in 1993. The evidence base for borderline personality disorder is strong. Studies show that well over 50% of BPD patients stop meeting the diagnostic criteria within the first year of starting DBT. Those are significant numbers. The question is whether those results translate into narcissism. Vaknin's skeptical. The original DBT trials were conducted almost exclusively with women in inpatient or residential settings. The gender applicability has never been adequately demonstrated. Men, Vaknin suggests, may express what he calls covert borderline differently, blending antisocial and narcissistic features under stress. If that's accurate, the standard DBT protocol may miss the specific emotional architecture of male-presenting cluster B pathology. What DBT actually does is target emotional and affect regulation. It connects schemas to needs to emotions. It validates the patient while teaching concrete problem-solving skills, distress tolerance, interpersonal effectiveness, and mindfulness. These are real tools that a narcissist genuinely lacks. If the narcissist in your life also has severe emotional dysregulation, impulsivity, or self-harm, DBT may be the right starting point, even if it does not reach the core structure. The limitation is that DBT does not challenge the internal object relations template. It does not address the sadistic superego. It teaches the person to manage their emotional environment better, which is useful, but it does not rebuild the foundational self. There's schema therapy that maps the childhood wound. Where DBT targets regulation, schema therapy targets structure. Jeffrey Young developed this modality to address 18 maladaptive schemas organized across 5 domains. These schemas are enduring patterns formed in childhood where core emotional needs were not met. The schemas then drive behavior across the lifespan. The 5 domains map almost perfectly onto narcissistic pathology. Disconnection and rejection covers emotional deprivation, defectiveness, and social isolation. Impaired autonomy covers failure, enmeshment, and vulnerability to catastrophe. Impaired limits covers entitlement and insufficient self-discipline. Other directedness covers subjugation, self sacrifice, and approval seeking. Overvigilance covers negativity, emotional inhibition, and punitive standards. The last one's critical. Unrelenting standards and punitive self criticism are the exact machinery of the sadistic inner critic we discussed in episode 4. Schema therapy does not just describe the problem, it gives you the map of where the problem came from and how the different schemas reinforce each other. Vaknin reads the full schema list as what he calls a summary of everything wrong with cluster B personality disorders. In the disconnection and rejection domain, emotional deprivation, mistrust and abuse, defectiveness and shame, social isolation. In the impaired autonomy domain, dependence and incompetence, vulnerability to catastrophe, enmeshment, failure. In the impaired limits domain, entitlement and grandiosity, insufficient self-control. In the other directedness domain, subjugation, self-sacrifice, approval seeking. In the over-vigilance domain, negativity and pessimism, emotional inhibition, unrelenting standards, punitiveness. The relentless standards schema deserves particular attention. It's the belief that striving to meet unrealistic high standards of performance is essential in order to be accepted and avoid criticism. The punitive standards schema follows directly from it the belief that others should be harshly punished for making errors. Together, they create the inner machinery of the sadistic superego, the inner critic that drives the narcissist's constant dissatisfaction with themselves and everyone around them. Schema therapy uses 3 coping styles. Schema maintenance is when the person perpetuates the harmful pattern. Schema avoidance is when they run from situations that trigger it. Schema compensation is when they overcorrect in the opposite direction, which in narcissism looks like grandiosity. All 3 keep the false self locked in place. The therapeutic work is to modify the schemas, which is more achievable than full reconstruction. Jung himself acknowledges that modification is easier and faster. The goal is not to erase the wound, but to loosen its grip on current behavior. Between schema therapy and TFP is a modality called pattern-focused psychotherapy. It's developed by Sperry and defines a pattern as a predictable, self-perpetuating style of thinking, feeling, acting, and self-defense. Patterns can be adaptive, helping a person achieve goals and secure favorable outcomes from their environment, or they can be maladaptive, inflexible, and self-defeating, generating dysphoria and impairing functioning across settings. The therapeutic task is to replace hurtful maladaptive patterns with adaptive ones by bringing the pattern into focus. The therapist helps the patient see the self-defeating cycle clearly, then guides them toward alternative responses. Vaknin notes that this approach shares with schema therapy an assumption central to most modern psychotherapies that early in childhood, the person was malformed by inadequate parenting. The newborn begins as raw material. The parents sculpt this material. When they do not know what they're doing or when they are themselves damaged, the resulting object is deformed. The shared assumption across DBT, schema therapy, and pattern-focused psychotherapy is important. It means the therapeutic target in each case is some version of the same underlying problem. Maladaptive patterns formed early, maintained by coping styles, and expressed across the lifespan. And then there's transference-focused psychotherapy, which attempts to fix the internal template. Otto Kernberg developed transference-focused psychotherapy, TFP, from object relations theory. His premise is that infants form internal representations of the self and other connected by emotion. When these representations fail to integrate, you get the split between all good and all bad that defines borderline and narcissistic structures. The key therapeutic mechanism is transference. The narcissist projects their internal objects onto the therapist. They begin treating the therapist as they treated or were treated by their caregivers. The therapist becomes a surrogate parent, a source of validation, or a target for rage, depending on which internal object is dominant in the moment. This is not a bug, it's the mechanism. Kernberg deliberately encourages transference because it externalizes the internal template. The therapist provides consistent empathy and uses the transference relationship to expose the distortion. Over time, the patient begins to see the pattern. They integrate positive and negative representations of self and other rather than flipping between them. The goal is identity integration. The narcissist moves from splitting to holding a coherent, complex internal model of self and others. This is the deepest structural change available through any modality. Vaknin, who trained in object relations himself, describes this as beautiful if you are an adherent of the framework. The idea that you can correct a faulty internal template through consistent empathy as the patient re-experiences early relational dynamics in the safety of the therapeutic relationship is a powerful one. The limitation is intensity. TFP requires the patient to tolerate significant emotional activation over an extended period. Many narcissists flee before the work takes hold. It is also relatively scarce. Finding a properly trained TFP therapist is not simple. There's MBT, Mentalization-based treatment. It was developed by Anthony Bateman and Peter Fonagy, where TFP is confrontational, MBT is reflective. The premise is that borderline and narcissistic disorders involve impaired mentalization, which is the capacity to understand your own and other people's mental states accurately. MBT provides a secure attachment experience within the therapeutic relationship. The therapist reflects on and correctly labels the patient's state of mind. Over time, the patient learns to do this for themselves. They develop impulse control by understanding what is happening in their own mind and in others. MBT has received strong efficacy ratings from Division 12 of the American Psychological Association, which reviews evidence-based treatments. The approach is less invasive than TFP and better tolerated by patients who cannot handle high-intensity transference work. The trade-off is scope. MBT improves relational skills and mentalization. It does not directly restructure the internal object relations template that the way TFP does. For the narcissist who wants to be less destructive in relationship and more accurate in reading other people's intentions, it is genuinely useful. For the narcissist who wants the deeper structural change, it's incomplete. And so we get to cold therapy, Vaknin's own modality. Cold therapy is based on two premises. First premise, narcissistic disorders are forms of complex PTSD, CPTSD. Second, they are outcomes of arrested development and attachment dysfunction. Now, there's a controversial word, arrested development. It means development stopped at an early age, leaving the adult running on child-level defenses. If both premises are true, then standard therapeutic approaches are treating symptoms without addressing the developmental arrest. Cold therapy tries to recreate the conditions for genuine developmental restart through controlled re-traumatization in a hostile, non-holding environment. Hostile, non-holding environment. The therapist does not provide the holding environment that most therapists consider essential. Instead, they recreate the ambient conditions of the original trauma and guide the patient through a second encounter with the wound. Cold therapy techniques include erasure, grandiosity, reframing, guided imagery, negative iteration, mirroring, escalation, role play, hypervigilant referencing, and reparenting. Vaknin describes the approach as borrowing from child psychology because, in his framework, narcissists are children in a post-traumatic state. Let me ask you a question. Have you ever encountered someone who acts like a child when distressed? Hypervigilant referencing is one of the more distinctive techniques. The therapist provokes the narcissist by constantly returning to the originating trauma, the original wound identified during the erasure phase. The narcissist protests. The therapist does not stop. Over time, this generates what Vaknin calls secondary delusions, temporary paranoid ideation that makes the narcissist extremely sensitive to perceived threats from the therapist. The hypervigilance exposes the defensive architecture. It shows the therapist what the narcissist is actually defending against. This is why, by the way, it's called cold therapy. It's not warm. It's confrontational by design. Reverse splitting is another key technique. The therapist deliberately occupies the role of the bad object, the abuser. This forces the narcissist into the position of the good object. In this reversed position, the narcissist begins to have access to the true self. The true self in this framework is what emerges when the narcissist is no longer defending against being the bad object in relation to an abuser. Because as a child, they were the bad object. It is a genuine self that exists underneath the grandiosity and the defenses. And then, reparenting is perhaps the most misunderstood technique. Very important. This is not surrogate parenting. The therapist does not try to be a good parent. The therapist becomes, through forced transference, the abusive parent figure. The reparenting happens through the transference relationship, not through the therapist acting as a caregiver. The result, according to Vaknin, have been very positive with a very limited sample of clients who completed all three levels. These are not peer-reviewed. These are Vaknin's own results with his own clients. The metaphysical framework Vaknin suggests the client should regard their life as a movie. At every inflection point, the question is whether you would pay to watch this scene. Would you pay to watch the version of your life you are currently living? If not, a transformative change is called for. It's a genuinely useful philosophical exercise regardless of what you think of cold therapy as a modality. Most narcissists are living a performance they would not pay $1 to see. The exercise forces a confrontation with the gap between the fantasy and actual experience of being alive. Cold therapy is the only modality that directly addresses the developmental arrest at the root of narcissistic structure. If Vaknin is right that narcissism is CPTSD plus attachment failure, then controlled re-traumatization makes theoretical sense. But the sample is small. The method is intense, and replication has not happened in an independent setting. Let's kind of end the video with this. Most therapists try to co-opt the narcissist's false self. They appeal to the quest for perfection and brilliance. They suggest that if the narcissist just tries harder, follows the program better, performs more perfectly, they'll feel better. This is contracting with the false self, contracting as in colluding. The therapist becomes another audience for the performance rather than a witness to the person underneath. Real therapeutic progress requires the therapist to become a genuinely non-shaming presence, someone who can see the gap without weaponizing it, someone who does not need the narcissist to perform in order to be valued. That kind of consistent, non-reactive presence is rare. It requires years of the right kind of relationship to create the conditions where the false self might actually relax. And now it makes sense. This is why Vaknin says that no therapy taken alone is sufficient. Changing the inner architecture of a personality disorder requires more than techniques. It requires a controlled shattering of the structure that has been holding the person together since childhood. And it requires a relationship that can survive the shattering without recreating the original trauma. Now here's where I think the book OLNE is important, but it's not a therapy modality. It's a philosophical frame. And this can be quite profound and beautiful. Therapy can reduce symptoms, it can modify behavior, it can provide the conditions for structural change, but no therapy can give you co-independence. That is a choice a person has to make from the inside. Two whole people interdepending, not two deficit structures managing each other. That is what genuine change looks like in a relationship. Open communication is the OLNE principle, pillar principle, most relevant here, and it's what healthy therapy feels like from the inside. When therapy works, it's because the narcissist experiences the first time what it feels like to communicate without fear of punishment. Really let that sink in. One's ability to communicate without emotional, psychological punishment and blackmail. And really see why that's important in relationships and how it applies. The therapist does not withdraw when they express something ugly. The therapist does not escalate when they push back. The therapeutic relationship becomes a laboratory for a different kind of relating. The other primary framework from OLNE is co-independence. Co-independence is a destination that no therapy can hand you. The therapies in this episode can get the narcissist to the door. Only the internal choice to want another person's well-being for their own sake can open it. And this is the other pillar of the OLNE, non-conditional love, that demonstrates this, that facilitates this. And apropos non-conditional love, here's the song Non-Conditional Love by Stacey X from the album Final Shared Fantasy. I'll see you in the next episode. Bye.
You came in bent like a chair by the rain, hands full of thunder and a name for the pain. I saw the bruise map under your skin, and I did not reach for the lock within. I know the shape of your running away. I know the night you were made that way. So I sat with the door and I let it stay. I love you, oh, I love you, oh, oh, I love you, oh, with the cracks in the weather, leaving you, oh, I love you, oh, I love you, oh, oh, I love you, oh, I won't try to fix what made you so. You bite your tongue when the room gets still. You make a small fire out of your will. I used to think love meant to cure I love you, ho. I love you, ho. With the cracks in the weather, the leaving you hold. I love you, ho. I love you, ho. I love you, ho. I won't try to fix what made you so. I love you, even wound is part of home.